Good day. My name is Dr. Alison Bentley, and this is a very short video to walk through most of the significant sleep disorders. I hope you find it helpful. So just to give you a bit of background, I am a medical doctor, a GP by training. I am currently mostly in private practice. I have seen patients with sleep disorders for 30 years, and I'm the current chair of the South African Society for Sleep and Health. So if we look at the major sleep disorders, we'll see that there are some standard symptoms that we can look at. So firstly, there is a reduced quantity of sleep. This would be classically patients who have insomnia, and we'll look at all of these definitions as we go through. But there's also a concept called the naturally short sleeper. Then there is a reduced quality of sleep leading to excessive daytime sleepiness. Primarily, this symptom is patients who are able to get enough hours of sleep, so 7 to 8 hours, but still feel tired when they wake up in the morning and then feel sleepy or tired throughout the day. Two main disorders here, obstructive sleep apnea and periodic limb movement disorder. And then we have parasomnias. And these are two types, ones that happen in the non-REM stages of sleep or deep sleep, and ones that happen in REM sleep. Now, the symptoms are pretty much all the same, no matter what sleep disorder you have. The kind of symptoms that people present with is reduced daytime functioning. So executive functioning, thinking laterally, being innovative, effective communication, fatigue, or daytime sleepiness. In fact, if you have a sleep disorder, usually there's an attention deficit, not the attention deficit disorder, but an attention deficit, inability to concentrate, focus, and be productive. So it's important to understand what normal sleep is, particularly when we're talking about insomnia. So 7 to 8 hours is often quoted, and Dr. Google will tell you that 7 to 8 hours is the normal amount of sleep. Now, it's not the normal, but the average amount. So if you look at an entire population, that most people are going to have 7 to 8 hours. There are plenty of people who can't sleep for 8 hours, no matter how hard they try. Now, you either, if that's the case, you cannot sleep for 8 hours, no matter how hard you try. You either have insomnia or you're a naturally short sleeper. So insomnia, by definition, has to have a drop in daytime function. So there has to be a deficit. You have to have that concentration lack. As a naturally short sleeper, if you can only get 5 hours of sleep, but you're perfectly functional during the day with no deficit, then you may be a short sleeper, which is genetic, and you can't change that. Also, your timing might be different. So you might be a lark, that's someone who goes to bed early and wakes up early, or an owl that goes to bed late and wakes up late. And that is also genetic, kind of biological. If we look at insomnia, there are many causes of insomnia, and they range from absolute causes such as medical problems, such as pain, or medications that you might take, such as steroids, environmental causes, too dark, too noisy, too light, too cold, too hot, those kinds of things. Then the true sleep disorders, and there's three main ones: restless leg syndrome and periodic limb movement disorder, circadian rhythm disorders, and obstructive sleep apnea. And obviously there's quite a close link between the sleep disorders and psychiatric disorders such as anxiety and depression. A lot of the insomnia that we see is actually psychological, and it started with an acute stress, so a death in the family, exams, something that was acutely stressful. But then it changed and created abnormal thinking and abnormal behaviors, which then creates a self-sustaining chronic insomnia. In fact, most of the patients I see with insomnia tell me that they do not know why they have insomnia because there doesn't seem to be any cause. And then we're talking about the psychological type of insomnia. So let's look at the true sleep disorders: restless legs and periodic limb movement disorder. Restless legs is an urge to move the legs, sometimes associated with an uncomfortable sensation. This happens only or is worse at night, so particularly when you try to go to sleep, worse at rest. And when you move, you actually feel better. So the feeling better is only while moving. It's a very strange sensation, but it's very clear, this urge to move. I have to move my legs. Once people fall asleep, what we see here on the sleep recording are these jerks or excitations that happen within the muscles during sleep. And what they do is actually break the sleep. So have a little break in the sleep. And so however long this goes on for, if it's an hour, for example, of sleep, that hour did not happen because sleep was actually cut into 20-second bits. And so you can't have good quality sleep. So this presents, if you have restless legs, often presents with insomnia, difficulty falling asleep. If you have periodic limb movements, it can present with waking unrefreshed, and often the two disorders often happen in the same person. Then if we look at circadian rhythm disorders, these are really melatonin related. Now, I'm sure many of you have experienced jet lag or shift work, problems with shift work, but there are things called delayed sleep phase syndrome and advanced sleep phase syndrome, and these are severe owls. So these are patients who can only go to sleep at 3 o'clock in the morning and then need to sleep till 10. Or advanced sleep phase, these are people who go to sleep at 8 or 7 at night and wake up at 2 in the morning, having had 7 hours of sleep, but obviously an inappropriate time. Now, in these patients, the melatonin is normal. However, there's a large group of patients, and more people are being described, that have abnormal melatonin secretion. Now, melatonin is the hormone that gets you to sleep and that keeps the quality of your sleep good. So poor melatonin is found in the elderly patients, so really over the age of 55, but certainly once you get to the ages of 70 or 80. Blind folk, where there's no light perception, neurodevelopmental disorders such as autism spectrum disorder in children, depression, Alzheimer's, and patients who are in ICU. So there are clear disorders where melatonin is lacking, and in these disorders you can supplement the melatonin and often get some relief. When we look at excessive daytime sleepiness, the number one cause is obstructive sleep apnea. And these are patients who snore severely, but there are gaps in the snoring. So there seems to be periods where they hold their breath. It's very important to understand that sleep apnea is not a lack of breathing. The brain is trying to breathe, but it is a closure of the throat, as shown in this diagram here. It is a closure at the back of the throat, understanding that that part of the throat is designed to close every time you swallow, but shouldn't close when you breathe in. But that negative pressure of breathing in. So a combination of age, so advancing age, sedatives, so things like alcohol or sleeping tablets, and then any blockage in the nose, an extra long palate, the tongue moving backwards because the jaw moves backwards when you lie on your back, for example, or excessive weight, particularly in men, put on weight around the neck area, which narrows down the throat. Usually there's a combination. It's usually not just one of those things, but a combination of those means that you snore because the air is moving through and it's very turbulent, or apnea where it actually closes off. When it closes off, your brain wakes you up to start breathing again. And if that continues to occur, so you go back to sleep and you have another apnea and wake up again, then again your sleep gets chopped into small pieces, waking up in the morning feeling tired and often very sleepy during the day, falling asleep in situations which are inappropriate, such meeting or work, or hopefully not, but while driving as well. The parasomnias are in a unique group. They don't usually create problems with sleep. So patients who have parasomnias usually don't wake up feeling tired. They usually don't have insomnias. But there are parasomnias. These are the strange things that happen at night. There are parasomnias that happen in the first part of the night. And this is non-REM sleep or deep sleep that happens in the first hour or so. And these include sleepwalking, sleep talking, night terrors. But now also what's been described is sleep eating. So going to the fridge and eating things and not remembering that. Sleep texting on the phones. So any kind of strange behavior that happens in the first hour of the night. Usually patients have no memory of it happening. The REM parasomnias occur in REM sleep, so this dark shaded area at the top, so usually towards the end of the night. And these are nightmares. They're usually dream related. So usually nightmares, I think all of us understand what nightmares are. REM behavior disorder is a disorder usually in older men, which occurs when they act out their dreams while they're asleep. The important thing about REM sleep and dreaming is that you should be paralyzed during REM sleep, allowing your brain to dream, fantasize, and do all kinds of things without any physical consequences. REM behavior disorder, that paralysis stops and starts, and so occasionally the paralysis will be off when you're dreaming, and patients tend to act out their dreams. If there are parasomnias, so anything like this that's happening plus daytime fatigue, then that usually means there's something like sleep apnea or leg movements which is triggering off these events at night. And so that needs to be investigated a little further. So in conclusion, there are a number of sleep disorders in very clear categories. What is important to understand is that all sleep disorders have treatment. It is possible to treat all of them. It just really depends how far you need to go to treat them. You are certainly better off having treatment than having poor sleep, because every single sleep disorder has been linked to increased cardiovascular disease or heart disease, increased incidence of diabetes, increased incidence of depression, and increased incidence of dementia. So you're better off having treatment than having no treatment at all. And if you feel like you may have any one of these sleep disorders, please tell your doctor about it. Specifically go and see them about that sleep disorder. And if they can't help, please ask to be referred to somebody who can help you. There are many specialists around the country and doctors who do have an interest in sleep disorders and can help you. So I hope that was useful. And if you want any more information, please go onto Google and look specifically at some of those disorders. Please go to reputable websites such as the Restless Legs Foundation, the sleep foundations that are found in the US and in Britain and in Australia. Some really good information. Please don't just go to blogs and personal opinions. Thank you very much for listening.